done. Okay. All right, good afternoon. I think we're about ready to get started. So we've got our technician clinical programs this afternoon, and our first speaker is Dr. Behrend. Just a quick background on her. She received her VMD from the UPenn in 1988, followed by an internship at Michigan State, and then a couple years in private practice. She completed a residency in small animal internal medicine and a master's at Colorado State in '94 and a PhD in 2001 at Auburn University. She also serves as a consultant for Auburn University Endocrine Diagnostic Service and VIN, and is currently the Josie Griffin Professor in the Department of Clinical Sciences at Auburn University. Dr. Behrend has received the Daniels Award for Excellence in Small Animal Endocrinology, the Dean's Award for Excellence in Teaching, and the Norden Teaching Award. She has also authored and co-authored over 100 abstracts, journal articles, and book chapters, and she is also, of course, board certified.
Thank you. So welcome to this afternoon's talk. This is Josie Griffin. I'm the Josie Griffin Professor. And I just like showing this picture because it cracks me up that the donor named the chair after her dog rather than herself. So this is Josie Griffin. My original title, I'm a grammar nut. My mom drilled it into me when I was younger. The original title for this was Tips for Diabetic Cat Owners, and then I was making this slide and I thought, well, how do you know if the owner's diabetic or if the cat's diabetic based on that title? So I had to switch it to Top Tips for Owners of Diabetic Cats. And this talk is dedicated to Madison. This is my cat. He was my cat, unfortunately. He died a few years ago now from FIV, but he was my foray into being a diabetic pet owner. He became diabetic for a while, and he taught me a lot of things. He was a very special cat. I had 3 presidents at the time, Jefferson, Madison, and Jackson. They were all cats, and I had a presidential theme going. And I had absolutely lived in fear of the day that one of my cats would become diabetic. I do endocrinology for a living. That's my focus. But diabetes is my least favorite endocrine disease, and I really did not want the experience of being a diabetic cat owner, but it finally happened. Madison was a very special cat in more ways than one. I had adopted him from the pharmacology laboratory at Auburn University. So he had been used to teach second-year pharmacology students, vet students, about different tranquilizers and anesthetic agents. So he had been manhandled by second-year veterinary students for a year and had been tranquilized multiple times. And when I first adopted him, his best friend in the world was a ficus tree. He and the ficus tree communed for hours. He would sit there for hours and do nothing but stare at the roots of this ficus tree. So he was a very special cat. And becoming a diabetic was also a challenge. I could not curve this cat. When you tried to restrain him to get blood, he flashed back, had an acid flashback to his days as a pharmacology laboratory cat, and he went ballistic. He wasn't vicious, but he went ballistic, and every time you tried to take blood from him, his glucose was going to be elevated because he was a nutcase. So I learned a lot from Mr. Matty Man. Unfortunately, he died. He did go into remission. That was a very good thing about his diabetes. He wasn't diabetic for that long, but unfortunately, he died from his FIV a few years ago. Okay, so when I was putting this talk together, I was thinking about the things that I thought it would be really important for owners to know. What did I learn from Madison, and what do I go over a lot with owners as a veterinarian when I'm starting to teach them about having diabetics? So tip number 1, which I think is a very important one, and this is all about cats, diabetic cats can go into remission, which owners, it really freaks them out because diabetes doesn't typically go away. But diabetic cats can go into remission. The quicker the diabetes is controlled, the more likely it is that remission is to happen. And I think that's a very important point, which makes me get more aggressive about treating diabetes to begin with. I'm not going to waste a lot of time trying oral hypoglycemic agents in cats. I'm not going to try only diet first. I'm going to get fairly aggressive and put them on insulin straight off because I want to get control of their diabetes as quickly as possible with the hopes that if I do, it's going to put them into remission. So why do diabetic cats go into remission? That is a very weird thing, and this is the theory as to why it happens. So you have a diabetic cat who's not quite normal. Its pancreas is not normal. It may be accumulating amyloid. They have chronic pancreatitis, something. Their pancreas is not quite normal. But at that point, it's good enough. It's secreting enough insulin that it controls their blood sugar and they're not a diabetic. Something happens, some stress, and they develop stress hyperglycemia. And stress is very loosely defined. Emotional stress, the owners moved, the cat was boarded for a while, it got sick and developed stress hyperglycemia. Something happens that they develop stress hyperglycemia, and then they develop glucose toxicity, which is totally counterintuitive. Glucose toxicity means that prolonged hyperglycemia, and it doesn't even have to be that prolonged, 2 to 3 days is good enough. Prolonged hyperglycemia actually suppresses insulin secretion. Totally counterintuitive. Why would high blood sugar suppress insulin secretion? We don't know. Strange but true. It definitely happens. So the hyperglycemia actually in a few days or so can suppress insulin secretion. The closer they are to becoming diabetic, the more abnormal their pancreas is to begin with, the easier it is for them to develop glucose toxicity. The closer they are to that tipping point already, the easier it is for them to develop glucose toxicity. Well, the good thing about glucose toxicity is that it is reversible, especially in the early phases. So they develop glucose toxicity, their insulin secretion goes down, they progress to becoming a full-blown diabetic. We come along and we treat them, we control their hyperglycemia quickly, we control their hyperglycemia, the glucose toxicity goes away, insulin secretion returns, and the diabetes goes away as well. Now remember, they weren't normal to begin with. They were already heading toward potentially becoming a diabetic. So when the diabetes resolves, it's always possible that the diabetes will come back again as well because they are set up to become a diabetic from the get-go. How quickly it's going to come back is very variable. Sometimes it's a few weeks, sometimes it's a few months, sometimes it's never. Unfortunately, that's totally unpredictable. Is there anything that you can do to prevent the diabetes from coming back? We honestly really don't know. The recommendation is once they're in this phase where the diabetes has gone away, feed them what we consider to be a diabetic cat diet, high fat, high protein. Clinical impression is that that does help the diabetes stay in remission. We don't really know that for sure, but that is my recommendation. Once the diabetes goes into remission, then you want to keep them on that diet if possible. Cats with renal failure, you don't want to feed them high protein, so I wouldn't go with that. But if they are able to eat that high fat, high protein diet, they like that high fat, high protein diet, then keep them on that diet as well. And that may help them to not become a diabetic again. There was one study, or a couple studies actually now, looking at whether you could potentially predict whether or not a cat was going to go into remission, what were predictive factors for that. And this is a study, it was published in the Journal of Feline Medicine and Surgery in 2009 from Jackie Rand's group. She's down in Australia. She does a lot of really great feline diabetes research. And they looked at a number of cats that they had these cats on a very, very, very intensive insulin protocol. I mean, these owners were measuring the cat's blood sugar 2 to 3 times a day, adjusting insulin doses based on these 2 to 3 times a day measurement. Most owners are not going to do that, which is fine. But these were very, very intensely managed diabetics. And what they found was the predictors that they would go into remission was if they had entered this protocol within 6 months of becoming a diabetic. If they had been a diabetic for longer than 6 months before they went into this protocol, the chance for remission was about 34%. About 34% of those cats went into remission. If they were put into this protocol within 6 months of being diagnosed, then the remission rate was about 84%. So huge difference there. That was statistically significant. If you manage their diabetes more aggressively to begin with, within that first 6 months, your chances are for the cat to go into remission are much higher. And to me, that's the ultimate goal for a diabetic cat, is to go into remission. If I can make that diabetes go away, that's what I want to do. They also found that the lower the maximum dose of insulin required for that cat, you put a cat on insulin, you work upwards on the dose until you find out what controls them, and then as they go into remission, you start backing off the dose again. The lower that maximum dose that you reached, the better the chances were that they were going to go into remission. So they seemed to plateau on 2 units, and then they started backing down. That was better than if they required all the way up to 6 units per se before you started backing down. In this study, now this was not found in another study, in this study, all of the cats that were on steroids at the time they were diagnosed with diabetes or had just recently been on steroids, they were all taken off of steroids, and all of those cats went into remission. So if the steroids is what pushed them over that edge and is what made them become full-blown diabetic, if you can take the steroids away, your chances of making the diabetes go away are very good also. As I said, that was not found in another study, but they did find it in this study. The one thing that said that they probably would not go into remission, this is not 100%, but if the cat had already developed a diabetic neuropathy that we see where they come in and they're walking dropped on their hocks, if they had already developed that diabetic neuropathy, the chances of them going into remission were really pretty low. This is another study that looked at predictors for remission. This is out of Claudia Reusch's group. She's at the vet school in Zurich, and this was published in the Journal of Veterinary Internal Medicine. So this is a probability curve. So this is the percent of cats that went into remission, everywhere from 0 to 100%. This was done on 45 cats, and this was the day after diagnosis. So at diagnosis, of course, none of the cats were in remission, and then every time another cat went into remission, the line goes up. So you can see that this line climbs pretty steeply. So most cats, they're 60 to 70% go into remission with about the first 3 months, and then after that, it starts to drop off a little bit as well. If they're going to go into remission, it's going to happen relatively quickly, and the longer it has been since they were diagnosed as a diabetic, the chance of remission drops off. It's going to typically happen relatively quickly, and you want to be aggressive to get them to do that. Tip number 2, diet is definitely important for cats, diabetic cats, and canned food is preferred. So for the longest time, we were talking about high-fiber diets as being preferred for diabetics, and that is still what we're saying in dogs. The diet theory has only changed in cats, and it has definitely been shown in older studies that high-fiber diets will help some cats. With diabetic cats, same dose of insulin, moderate fiber versus high fiber, the high fiber cats do have lower blood glucoses. So it definitely can help to lower blood glucose. It also can help to lower lipid levels in the blood. High fiber decreases triglycerides and cholesterol in the blood. Hyperlipemia probably is a factor toward insulin resistance. So lowering lipids in the blood can help as well to decrease insulin resistance. The cons against using a high-fiber diet is that there are actually now some theories out there that high fiber may actually aid in the development and further progress diabetes mellitus. Cats were not made to eat a high-fiber diet. In the wild, they're going to be eating mice and rats pretty much predominantly, and mice and rats are not high fiber. They're pretty much all protein and fat. So cats are not developed to deal with this high fiber. High fiber may lead to pancreatic burnout, which may aid in the development of diabetes or cause its progression once it has developed. Cats don't have the same enzymes in the liver for metabolizing glucose. There's all sorts of different things about cats. Cats are wonderful. I'm a cat person. But they are definitely a different animal, and they just don't handle that high fiber nearly as well as dogs or people do. Another thing about high fiber is that it causes prolonged post-meal hyperglycemia. So we want to try and limit the amount of glucose that's being absorbed from the gastrointestinal tract. We want to keep that as low as possible in a diabetic animal. And one thing about fiber is that it keeps that peak down. Blood glucose doesn't peak as high on a high fiber diet. That's good. But it stays higher longer. It prolongs that postprandial hyperglycemia, and that's not good. So that's another bad thing about fiber. So based on that and some studies that are out there, the current recommendations are to feed a cat a high-fat and protein diet, low-carbohydrate, what people refer to as the Catkins diet. High-fat, high-protein, low-carbohydrate. And there are some prescription diets out there on the market. This is Purina DM. Hills has MD. There are some other prescription diabetic diets out there as well. Canned is the much better way to go if the cat will eat it. Canned is much preferred. Even if you're eating DM and MD, canned is still much better. Canned foods are always going to be lower carbohydrate than their dry counterparts. It's very hard to make a low carbohydrate dry diet. MD and DM have managed to do that, but dry diets are always going to be higher in carbohydrates. Not all owners can afford MD and DM, and I'll get back to that in a minute. But those are good diets. Some people, because they can't afford it, the Hills Growth is also a high-fat, high-protein diet. Pediatric diets are going to be high-fat, high-protein to stimulate growth. And a canned growth diet is okay. A dry growth diet is not okay. The dry growth diets are much higher in carbohydrates than the dry MD or DM. So dry MD or DM is okay. It's not as good as the canned, but they're okay. Canned growth is okay. Dry growth diets are not high protein. Are not high protein, high fat. The dry growth diets are not nearly as good. So this is data taken from Purina when they were first looking at their DM diet. So in this study, there was cats that were diabetics. They were on insulin. You can see over here their insulin requirement at the beginning of the study. They switched their diets to the DM formula, the Purina DM, and they monitored their diabetes over a period of time. And you can see that in pretty much all the cats, not all, but pretty much all of the cats, their insulin requirements decreased just in response to the diet, and a number of cats, their diabetes went into remission during this period, and they came off insulin altogether. The only thing that they changed during this period was the diet. So clearly, the high-protein, high-fat diets can have a beneficial effect on the control of the diabetes. There was one study published by Tanya Hall in the Journal of Feline Medicine and Surgery for those owners that can't afford the DM, MD. They are expensive prescription diets. She did a study looking at 2 different diets. She was using 12 diabetic cats. They all were receiving glargine insulin for their insulin. And she compared the low-carbohydrate, high-protein Purina DM combination of canned and dried to cats that were eating Purina Pro Plan Dry and Friskies canned as a combination as well. And she found no difference between the groups with respect to their insulin requirements, their diabetic control, and 1 cat in each group went into remission. So based on this study, it would say that there are some market brands, grocery store brands, that you can use with the same success as potentially something like Purina DM. Couple caveats about this study. One is that this is a very small study, only 12 cats. It's very possible that it would, if they had used more cats, that they would have found a significant difference. So very small study makes it more difficult to interpret the results. The other thing is that they were using very specific grocery market brands that were relatively high protein, high fat, and low carbohydrate. But really there's a lot more nutritional information on the bags, on the label for the prescription diets as compared to grocery market diets. You don't get nearly as much information. So sometimes trying to really figure out for diets that you buy in grocery stores exactly what the protein and fat concentration is not always the easiest thing in the world. So pick your diets very, very carefully. But at least based on this study, it would say that if you truly do have a grocery store diet that is on the high side for protein and fat, it probably is good enough. I would still go with DM and MD if the owners can afford it, but if not, you probably do have some other options out there. So exactly how important is diet? I don't think we really know. The 2 slides ago, I showed you those cats where diet made a big difference for them. It makes a difference. It absolutely makes a difference. But it is not the end-all and be-all. I am not the best cat owner in the world. I love my cats, but I am not the best cat owner in the world because I have 10-year-old twins and a full-time job and everything else. So I don't meal feed my cats. And when Madison became diabetic, I was not going to feed him MD or DM because trying to meal feed 3 cats and feed them separate meals was honestly more than I could handle. And Jefferson, one of the other presidents, had renal disease, and I did not want to put him on a high-protein diet. So I came up with a diet that was kind of halfway between what Jefferson needed and what Madison needed and fed them all the same thing. So Madison was not on DM or MD, and he went into remission. So it is definitely important. It is not the end-all and be-all if the owner can't afford it, they don't want to do it for whatever reason, etc. But it certainly is the ideal. One big thing that we worry about is renal disease with cats. Diabetic cats tend to be older. A lot of these patients have renal disease as well. And for renal disease, we're going to want to feed a low-protein diet, not a high-protein diet. So a diabetic cat with renal failure, which we definitely deal with often, do you feed high protein for the diabetes or do you feed low protein for the renal disease? No one really knows the answer to that question, but I think the consensus is feed low protein for the renal disease. The renal disease is probably the more immediately life-threatening problem that the cat has, so people tend to go toward feeding the low-protein diets for the renal disease. One option you have with cats that are on a higher carbohydrate diet than what we consider ideal, I'm going to talk about the oral hypoglycemic agents in a few minutes. Acarbose is one of those. It limits starch and fiber digestion. So for cats that are on a higher carbohydrate diet, you can add in acarbose to try and move them toward the ideal of a low carbohydrate. This kind of limits the effects of the carbohydrates that are in the diet. Acarbose is relatively expensive, however, and not a lot of owners really want to mess with pilling their cats either, honestly, but that certainly is an option, and I offer it to owners as well if the cat's not on DM or MD. I don't push it that hard. I don't think it's, the end-all and be-all, but it certainly is a good consideration for them. Palatability can be an issue. Some cats really don't like canned food. Some cats just don't like the high-fat, high-protein diets. They should be more palatable, but they don't like them for whatever reason. Don't sweat it. It really is okay. Feed the highest fat, high protein that they will like. Right now, as I said before, I'm going to mention dogs relatively briefly. We are still recommending high fiber in dogs, but stay tuned. That may change over the next 5 years. So I have heard about people, and people ask me, this cat looks like it's an early diabetic. Its blood glucoses are only in the 300s. They're not in the 500s. Can I just change their diet and not worry about insulin or oral hypoglycemic agents? And I am not the biggest fan of doing that. Going back to what we talked about at the beginning, so the whole theory about cats going into remission, etc. You want to resolve that glucose toxicity. You want to resolve it absolutely as quickly as possible. So as I said before, I get relatively aggressive about putting these cats on insulin. I'm going to do it as soon as possible, try and get control of their glucoses as quickly as possible to try and get them into remission. I don't think just making a diet change is effective very often, that it's successful very often, and then you've wasted a lot of time waiting to see if the diet's going to work, so that you're starting that much later with putting them on insulin, and I would prefer not to do that. So tip 3, giving insulin is difficult both for the owner and the cat. I stole this off of the web somewhere or something probably. I love this picture of the cat trying not to take a bath. But the same thing can be true of giving insulin. I do this for a living. I give injections for a living. I lecture about diabetes for a living. And the first time I had to inject Madison, it nearly brought me to tears, sitting there in the bathroom with Madison trying to give him his injection. It was really a very stressful thing. Insulin syringes are not that easy to read. He was getting upset about it. He didn't like his first injection, which I'll get back to in a minute. It is very traumatic, potentially, both for the cat and the owner, so you need to be very cognizant of that. Teaching owners to give injections, you should plan on a half hour in the exam room with them, walking them through how to give an injection, how to read the syringe, exactly what they should be doing, etc. We do it all the time. We think it should be easy. It's very foreign to most owners, and they're very upset about having to give injections to begin with in most cases. They need a lot of guidance, so at least half an hour to teach them how to do it, and then you're always going to have to check them again later. As I tell my students at Auburn, never, ever, 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 ever underestimate the ability of an owner to screw up giving insulin. You will be amazed. You go through it with them, you tell them very carefully, and then they're making mistakes that you can't believe that they're doing this. I had one client it was a husband and wife, and I showed them how to give the insulin, and the cat wasn't becoming regulated, and I couldn't figure out what was going on. So I had them come in and show me how to give the insulin, how they were giving the insulin. They would put the insulin bottle on the table, put the syringe in like this, and drew it up. Doesn't work very well when you're ejecting only air. And I said, that's not the way to do it. And I explained it again, and the wife said, I told you so. But don't underestimate the ability of an owner to screw up giving insulin. So one thing is that the owner may have to work with the cat, so to speak, to try and figure out the best way to do it. Making a big deal out of it, picking the cat up, putting it on a table, drawing it. You don't want to stress the cat out either. Glargine insulin, which is one of the main insulins we use in cats, which is my favorite insulin to use in cats, is a very acidic solution, has a pH of 4. And the first time I gave it to Madison, he didn't like it. So we had to work with that. So sometimes owners will give their cats insulin, or their dogs insulin for that matter, when they're eating. They're being meal fed, they come in, they're very excited about their food, they're chowing down, you're sure they've eaten the whole meal or they're about to, pop them with their insulin, they don't even notice what's going on. For Madison, we already had a ritual where every morning when I got out of the shower, he would come in the bathroom and I would sit down and I would brush him. It was our bonding time. So I got to the point where he would come in, I would start to brush him. I had his insulin ready. In the middle of the brushing, I'd pop him with his insulin and continue brushing him, and he never even noticed, and it was not a big deal after a couple days. And we just started doing that twice a day rather than once a day. Finding a place that the cat is comfortable, that it likes a lot. doing all sorts of things like that to make sure that they are okay with getting their insulin may be a necessity. Some cats don't even blink an eye. It doesn't matter what you do. You can give them their insulin, but some it takes a little bit of creativity. The syringes you use are very important. A lot of the insulins we use are U100, meaning they're a concentration of 100 units per mil. Cats, we're only giving 1, 2, 3 units usually to these cats, and that can be a very hard thing to measure. There are syringes made, they're called low-dose syringes, where they only pull up 0.3 mLs or 0.5 mLs as compared to a full ml of insulin. Accordingly, their scales are much, much bigger because it's a lower volume that they're drawing up, and they are much easier to read. So I am a strong advocate of the low-dose syringes to make it that much easier for owners to measure. One controversy is where you should give the insulin. And this is something that has come up relatively lately. Traditionally, we have trained owners to give the insulin in the scruff of the neck where we give a lot of injections. I don't think that is the best place to be giving insulin injections right here between the shoulder blades. That is not a highly vascular area. It can have a lot of fibrous tissue. So my impression is, and I have no proof of this either, but my impression is that the insulin absorption from that site is fairly variable. It is not consistent, and you need consistent absorption. So I train my owners to give it over the lateral thorax or in the flank area instead, where it has more blood vessels in the area, less fibrous tissue, less scar tissue, and it's probably absorbed better. Tip number 4. Pretty much every owner you deal with these days, it seems like they know a diabetic, human diabetic, or a pre-diabetic. And in people, most people are going to be on oral hypoglycemics to begin with, if not for their life, and they never have to go on insulin. And people think that giving pills to a cat is going to be easier than giving an injection. Personally, I think that's wrong. I think giving injections is way easier, but needles scare people. They think they would rather give pills. They know a human diabetic that is on these oral medications, and they want to know if they can give them to their cats as well. Unfortunately, they're not very effective in cats at all. We'll talk about the different ones that are available. There's really only one that I would even consider trying as a substitute for insulin. The other ones are not very effective at all. And the downside is that if you do try the oral hypoglycemic agent first and it doesn't work, again, you've lost that much more time until you put them on insulin. You have decreased your chances probably of that cat going into remission. So we talk about insulin in terms of type 1 and type 2. Those are terms that we borrow from human medicine. Type 1 insulin, type 1 diabetes means that the patient is totally insulin deficient. Something has destroyed the insulin secreting cells in the pancreas, pancreatitis, immune-mediated disease, something. So they've lost all of those beta cells, and they're absolutely insulin deficient. And that's what we see in dogs. They are type 1 diabetics. All dogs need insulin because they have destruction of their pancreatic beta cells. Type 2 diabetes is a lot more complicated and is the form that we think we see in dogs. It is the form that we think we see in cats. Dogs are type 1. Cats, we think, are mainly type 2. And this is the form that is by far much more common in people as well. So there are 3 things that go to making a type 2 diabetic. There's 3 abnormalities that occur together. One is that at least in the early phases, they have a decreased insulin secretory reserve. They can still secrete some insulin. It's just not normal amounts. As type 2 diabetes progresses, that probably will go away with time, but at least in the early phases of a type 2 diabetic, they still have some insulin secretory ability. It's just not a normal amount, not enough to keep blood glucose normal. Not only do they not secrete enough insulin, but they're less sensitive to it. They have peripheral insulin resistance. For any number of different reasons, the tissues just don't respond normally to insulin anymore. They are less responsive. So you have less, and it doesn't work as well either. Another thing that you can have with type 2 diabetes is increased hepatic glucose production. The liver is able to make glucose. Normally it makes glucose, and that's a good thing. So if your blood sugar starts dropping and you can't eat, your liver will make glucose so that you hopefully don't become hypoglycemic. But that gets a little bit out of control in diabetics. They have an increased hepatic glucose production. So these two things over here work so that not as much insulin is moving out of the system, and the liver is making things even worse because it's putting even more glucose into the bloodstream. So liver's putting it in, and it doesn't move out very effectively. Well, for the most part, the oral hypoglycemic agents are geared toward these abnormalities of type 2 diabetics. The one that we use the most, glipizide in cats, is a sulfonylurea, and sulfonylureas can stimulate the beta cells to secrete more insulin. The thiazolidinediones are all of the glitazones you may hear about, pioglitazone, rosaglitazone, darglitazone, etc. That and the transition metals, chromium and vanadium, they work to make the tissues more responsive to insulin. Metformin, which is glucophage, works by improving insulin sensitivity, and it also will decrease hepatic glucose production. So we have 5 types of oral hypoglycemics. 4 of them you see here on this slide. The 5th one is acarbose. These 4 are geared only toward the abnormalities of type 2 diabetics, which is why we don't use them in dogs. Dogs are not type 2 diabetics, so they only have a chance of working in cats, but unfortunately they don't work very well in cats at all. Glipizide, or glucotrol is the trade name. That is the one that we use the most, and it can work in some cats. Fairly small chance you're going to get a cat to go into remission on glipizide, but it can control their blood sugar, and it has been used successfully in some patients for more than 7 years. So some cats can be put on this and stay on it for life and have their diabetes relatively well controlled. Some patients, even if it works to begin with, it's going to lose effectiveness in a matter of weeks to years. There's only really 2 studies out there on glipizide in cats in the literature. The longest one was 16 weeks. Within that 16-week period, in some cats in which glipizide worked, 10% of cats, the glipizide had stopped working within that first 16 weeks. So, unfortunately, we don't have any numbers past that 16-week period. My guess is that the longer you go that the cat has been on glipizide, this number is going to go up. Within 6 months, it's probably higher than 10%. At 1 year, it's probably even higher again. So it certainly loses effectiveness in some. We just don't really know what that percentage is, but it's going to lose it in some, at least 5 to 10%. And unfortunately, glipizide only works in about 35% of cats to begin with. You only have about a 1 in 3% chance that glipizide is ever going to work in a cat. One thing about glipizide is that it can take 12 to 16 weeks to determine whether or not it works. It doesn't always work immediately. So you need to pick a patient that you have the time to wait, 12 to 16 weeks, hopefully, to see whether or not it's going to work. So we don't want to use it in patients that are emaciated, dehydrated, debilitated. They've already lost greater than 10% of their body weight. You don't have 12 to 16 weeks in those patients to see whether or not it's going to work. The ideal patient for glipizide is what we refer to as the healthy diabetic, those that come in and they're diabetic, but they're eating, they're drinking, they feel good, they're maybe peeing a lot, but overall they're really feeling pretty good. They haven't lost a lot of body weight, they're not dehydrated, etc. So a stable, non-ketotic patient, cat only, with mild signs, and it still is optimum to obese body weight. I would always try it in a cat in which an owner refuses to give injections. The 2 studies in cats that were done mainly on cats whose owners had refused to give injections, and they decided to try glipizide to see if it was going to work. Only worked in about 1 out of every 3 cats, so 2 out of every 3 cats it didn't work. And most of the time, by the time the cats had failed glipizide, at that point, the owners were willing to try injections. They had lived with the diabetes for a few months. They had worked with the cat. They decided it wasn't such a horrible thing after all. And by the time that they failed the glipizide, they were willing to give injections. So trying glipizide, you have a 1 in 3 chance it's going to work. And even if it doesn't, it may buy you some time. Unfortunately, with glipizide, it is absolutely impossible to tell which cats are going to respond or not. All you can do is put them on and try. Good news about glipizide is that adverse effects are relatively minimal, and they're usually transient. The number 1 side effect that we see by far is anorexia and vomiting. Only occurs in 20% of cats. It's not that it's that common a side effect in general, but of all the side effects that we see, it's the most common of them. We can certainly also see increased liver enzymes, very mild increases in some cats. The most serious complication that we can see with this is icterus. Some cats just get mild elevations in liver enzymes. Some will go on and become icteric and develop a full-blown liver failure. Again, this is usually reversible. You take them off of the drug and you nurse them through it, and it is a reversible thing as long as you're on top of it. It is an oral hypoglycemic agent, so it can cause hypoglycemia as well. Usually if a cat on glipizide is hypoglycemic, it means it has gone into remission. The other hypoglycemic agents, just to go through those quickly, again, none of these work very well, if at all. Vanadium and chromium are insulin mimetic. They do things in the cells that mimic the effects of insulin, and actually chromium was used to treat human diabetics before insulin became available as a pharmaceutical agent. So there is some history for it as well. I promise you, if your clients get on the web, which is probably all of your clients, if your clients get on the web, they will find information about chromium, if not chromium and vanadium, as far as diabetes is concerned. So there are at least 1 or 2 case reports in the literature that vanadium did work in a diabetic cat or so. It's relatively safe. It does cause some GI signs, and it will decrease water intake in diabetic cats as well, but that may be due to nausea and not due to control of the diabetes, and that would be a very bad thing. GI signs, not very common, but they can occur, and reversible renal failure was reported in 1 cat on vanadium. So there is 1 case report out there about orthovanadate, this form of vanadium being effective in 1 cat over 4 weeks. There's another case report out there, but that's all. So vanadium can work in cats, but it is probably not very highly effective at all. Chromium, we really don't know in cats. There are no studies on diabetic cats. And chromium, word on the street is it's not very helpful at all. There is 1 study in dogs that was done, never an oral hypoglycemic alone in a dog. It was done as an add-on to insulin. They treated them with insulin alone for 3 months or insulin in combination with chromium for 3 months, and there was absolutely no difference with or without chromium in their insulin dose. This is the data from that study. In JVIM in 2000, the study was done at Davis. So this is where they're being treated without chromium, insulin alone. This is with chromium here and insulin. And they measured fasting blood glucose, mean glucose concentrations, fructosamine and glycosylated hemoglobin. And you can see that there's no difference really between the groups. Chromium did not help in dogs. And again, it probably doesn't help in cats either. Metformin is another agent to consider. This is glucophage. You can see ads for this in Good Housekeeping and other magazines like that as well. There's one study out there which showed us what the dose should be in cats, 25 to 50 milligrams per cat twice a day. So there was a study from Davis which used these doses. They started at 25 milligrams twice a day and went up from there if they didn't respond. And they treated only 6 cats. So again, unfortunately, a very small study, but only 1 out of the 6 cats responded to the metformin. So not very encouraging at all. The alpha-glucosidase inhibitors, this is the agent that I mentioned before that you can add on to the diet if the cat's not on the high-protein, high-fat diet. You can add on this agent as a way to minimize the carbohydrate effects. And the alpha-glucosidase inhibitors inhibit alpha-glucosidase, obviously, but alpha-glucosidase is present in the intestines. These are little small intestinal villi where digestion is occurring. And these little blue boxes are the places that the alpha-glucosidase inhibitors work. So they work by preventing the digestion of starch, and they work by preventing the digestion of sucrose. So they really limit, to some extent, that postprandial glucose absorption from the GI tract. So by using this, the GI absorption of glucose is going to go lower, which is definitely a good thing. So we can use this classification of drug in dogs or cats with insulin. This is never a by-itself agent. You can use it with insulin potentially to help the insulin, to decrease the needs for the dose of insulin, etc. It is always an add-on to insulin. And as I mentioned before, cats that you put on a higher fiber diet than is ideal for diabetics, you can add in acarbose as well. In 5 insulin-treated dogs, this is the published study. Again, unfortunately, it's a dog study, not a cat study. They treated 5 dogs with acarbose at 2 different doses, and they definitely saw a good effect of adding the acarbose. The mean blood glucose, the glycosylated hemoglobin, and fructosamine concentrations decreased. But unfortunately, this is a relatively expensive drug, and it can cause dose-dependent side effects, soft stools, and from what I hear, pretty objectionable flatulence. So the overall conclusion from this study was that due to the expense and the side effects, only use it for dogs where the insulin by itself is inadequate. It's not going to be used for all dogs by any stretch of the imagination, and it's very rarely going to be used in cats as well. The thiazolidinediones are the last one. We really know nothing about these in diabetic cats. They cause severe side effects in people, and they are available only on a limited basis right now. Tip number 5, glucose curves are important to do. I am a big fan of glucose curves. Glucose curves are not perfect, and we all have cat patients that we deal with that look like this. When you come near them with a needle, that's not surprising. Glucose curves can be expensive, so not every cat is going to be curved. But if you can curve them, I am a very big fan of doing glucose curves. So this is one study, again a dog study, but what they did in this study, which shows you why glucose curves are not perfect in one way, is that for this study, they had 30 dogs in the study, and they hospitalized them for 2 days, and they did glucose curves on 2 consecutive days, and day 1 is here in the solid line, day 2 is here in the dotted line. Nothing changed between the 2 days. The feeding was the same, the insulin was the same, etc. It was just glucose curves on subsequent days, and you would love it to see that the glucose curves are identical day 1 and day 2. Clearly, they're not. They do change from day 1 to day 2, and which one is the one you're going to believe? You don't always know. That can be a difficult distinction to make sometimes. But clearly, they do change from day 1 to day 2. Some days day 1 is higher, sometimes day 2 is higher. These arrows mark the low point, the lowest blood glucose, and that varies from day to day as well. So they are not 100% perfect, and they need to be taken with a grain of salt, just like all of your other monitoring techniques. Spot checks are not very helpful at all either. The only time a spot check is going to be helpful is if you have hypoglycemia, and if you have hypoglycemia, you must decrease the dose of insulin. If it's not hypoglycemic, you cannot interpret a single blood glucose. So this is a diagram I stole from the textbook by Feldman and Nelson, but these are 3 possible theoretical glucose curves. Let's say you did a spot check here where all of the blood glucoses are around 150, and you could say, well, that's great. That's where I want my glucose to be. But that tells you nothing about what is going on the rest of the day. This dog was becoming hypoglycemic. In this dog, the insulin is not lasting long enough. In this dog, you have another problem going on. So a spot check is not going to tell you the overall picture, and I do not recommend doing spot checks. So when do we do blood glucose curves? There's a number of different times we do that. Anytime you start a patient on insulin or change their dose of insulin, you should do a glucose curve to assess where the new dose is going to get you. I like doing glucose curves about every 3 months. Once a patient is stable on insulin, I still like to do glucose curves about every 3 months to make sure that they are as well controlled as you think they are, number 1. And number 2, a very big reason to me for doing that is that we see a lot of patients where they are hypoglycemic. You measure that they are hypoglycemic, but the owner doesn't report any clinical signs of hypoglycemia. Maybe they weren't home they're at work when the cat's becoming hypoglycemic. Not all cats show all the obvious clinical signs of hypoglycemia, but on periodic curves, you can pick up the clinically undetectable hypoglycemia, and then you need to lower the dose of insulin. Anytime that you think a cat is hypoglycemic, the owner thinks they're seeing clinical signs, you definitely need to do a glucose curve to see if that is occurring or not. And if the clinical signs are seeming to recur, if it seems that the cat is coming out of control, you want to do a curve at that time as well. There are multiple things that will tell you that a cat is not being well controlled. It's PUPD, it's polyphagic, it's losing weight, its fructosamine is too high, its urine glucoses are consistently 4+, etc. There are multiple things that can tell you a cat is out of control. There are multiple reasons for a cat to be out of control. The insulin might not be at a high enough dose. It might be at too high a dose. It might not be lasting long enough. There are lots and lots of reasons for poor control, and the only way to differentiate between the reasons for poor control is to do a glucose curve and to know how to change the dose. That is the only thing that will tell you how to change the dose. The other thing tells you that you need to change the dose if they're out of control. The curve is the only thing that will tell you how to change the dose. Tip number 6 for doing curves, the importance of home monitoring cannot be overemphasized. I am a big fan also about having the owners keep journals and doing things at home to tell you how well controlled that cat is, because cats are prone to stress hyperglycemia. A cat is going to act differently when it's sitting in a cage and stressed out as compared to hanging out at home in the owner's office. So there's things that owners can do at home for you. They can measure urine glucose, and I think that can be very helpful. In general, I don't like to measure urine glucose to use that to decide how to change an insulin dose, but it can be done if necessary. There are protocols and textbooks for that. There are some cats you are not going to curve. They're mean. They're my cat Madison, who is a fruitcake, and every time I tried to curve him, I got 300, 300, 300. There are multiple reasons for not being able to do a curve, and you can use urine glucose in that case and fructosamine if you need to. But even if you are doing curves, I think urine glucoses add one more piece of the puzzle to try and tell you how well that cat is being controlled or not. Never rely on simply one monitoring technique. You have to do multiple. It helps you to assess ongoing control. The owners check urine glucose periodically. and it's always 1 plus 1 plus 1 plus. Now it's 2 plus 2 plus 2 plus. Then it's 3 plus 3 plus 3 plus. You're losing control. You need to do something. And it can also help to alert you that the dose may be excessive. If the urine glucose is always, always, always negative, then the dose may be excessive. You may be having periods of hypoglycemia, and you should curve that cat as well. And lastly, urine glucose monitoring is cheap and convenient, much cheaper than a glucose curve. As far as what to do to measure urine glucose, I'm a big fan of the Purina glucotest. And if you don't know those, basically what it is really little pieces of urine dipstick that are cut up and you sprinkle over the top of the litter. Cat gets in it and pees. The chips change color and concentration to the urine glucose. Owner comes back later and looks and sees what the color is. This is what is on the side of the multi-sticks bottle. This is the panel or the colors that you get with the glucotest chip, so very, very similar concept. We did one study at Auburn that we published recently to look and see how accurate the glucotest is, and I'm a big fan of this product. And we looked at urines that had relatively low glucose concentrations going on up to very high glucose concentrations. And we put the urine samples on the glucotest and then recorded the color at 0, 30, and 480 minutes to see if it really was as stable a color change as Purina claimed that it was, and we actually found, interestingly, that it gets more accurate with time, not less accurate. Overall, so these medium gray bars are the accurate readings, and you can see that they predominate. There was one reading here that was an underestimate. The darker bars up here are the overestimates, so if anything, the glucotest tends to overestimate, but it doesn't do it very often, and over time, this is the same chips read at 0, 30, and 480 minutes. Over time, they actually get to be more accurate. So highly accurate to begin with, and it even becomes more so with time. Some owners, you're not going to be able to push into doing a lot of home monitoring. Some love the fact that it feels like it gives them a lot of control. Some already feel chained to their cat by the diabetes, and doing something like a home glucose curve, which is another thing that I like to do, is way over the top for them, way more than they can handle. For those owners who want to be engaged, you need to keep talking to them, go over the curves with them, talk to them about what they're seeing at home. This is a huge resource for you in keeping the cat managed, and you want to keep the owner engaged as much as possible. Doing something like a home glucose curve, which again I'm a fan of, is going to take a lot of practice and a lot of encouragement and a lot of mentoring for the owner. So it's not the easiest thing to do. The learning curve is fairly steep for owners, but I highly recommend it. Let's skip that. Tip number 7, when doing a glucose curve, it is essential that normal routine be maintained. Sitting in a cage is never going to be anywhere close to normal routine, but you got to maintain everything else as normal as possible. When you are doing a glucose curve, the owner must feed that cat as usual, at the usual time. They must give the insulin as usual, at the usual time, the usual dose, etc. Everything except the fact of where the cat is sitting must be absolutely as normal in order to be able to interpret that glucose curve. Everything else has to be normal in order to interpret that glucose curve. And the last tip, unfortunately, when you're using insulin, hypoglycemia is always a possibility, and we always want to avoid that. So the owners need to know the signs of hypoglycemia and what to do in case they see it. So hypoglycemia actually causes 2 phases of clinical signs. The first phase is relatively subtle, and most owners don't notice it, especially in cats. But the body's first reaction to hypoglycemia is that the sympathetic nervous system becomes activated to try and increase the blood sugar epinephrine and norepinephrine and cortisol are going to be released, and you get muscle tremors, nervousness, restlessness, and hunger. And again, those are relatively subtle, and a lot of owners don't notice it if the owner's walking around more and is more restless or something like that. As it progresses, that's when the nerves start becoming starved for glucose, neuroglycopenia, and you start to see the neurologic signs, starting with lethargy and weakness, progressing to ataxia and bizarre behaviors, disorientation, finally going to seizures. Hopefully you'll see them before that, and ending in a coma if it gets to be severe enough. Oops. Clinical signs of hypoglycemia. As I mentioned before, the seizures can be relatively commonly seen, unfortunately, although that's something that we see more toward the end. And then all of the other things are harder for owners to notice, so they're probably not as common a presenting complaint. So insulin overdose, always make sure that the owners have something at home that's a high glucose syrup, Karo syrup, honey. There are oral high glucose syrups that human diabetics have at home for themselves, and they can put that into their mouth, being careful not to get bitten if they're seizuring. At the clinic, the dose that we use is 0.5 grams per kilogram of dextrose diluted 1:4 to begin with. That will not fix all cats. That is the starting dose, and then you go from there. There was one study from Penn that showed that it takes some cats up to 3 days on a dextrose drip to recover from an insulin overdose. A single injection of glucose by itself may not be enough, and you need to monitor that cat very carefully. The injection may bring the glucose up, the clinical signs go away, and then the glucose starts dropping again. You need to monitor that cat very carefully and keep feeding it as much as possible to get the blood glucose to go up and stay up. Anytime a cat becomes hypoglycemic on on insulin therapy, your first thought should be, is this cat in remission? Do not give insulin again until the glucose goes into the diabetic range, and it may never go into the diabetic range again. It may be in remission. Only give the insulin once the glucose goes into the diabetic range again, and when they do, it's always a minimum of a 50% dose reduction. Really decrease that dose of insulin if the last one made them hypoglycemic. And with that, I will end there, and I'm happy to take any questions. I went a few minutes over, but I'm happy to take any questions. The question is, when I do my curves, how often do I pull blood samples? And in general, I pull them every 2 hours. As I said before, I'm a big fan of glargine insulin in cats. And some people recommend that for glargine, you only need to pull the samples every 3 to 4 hours. I still do it every 2. When they start getting lower, though, around 125, I start pulling them every hour until they come back up above 125. And then I go back to every 2 again. And I don't put a catheter in or anything like that. I just do a peripheral stick. Yeah, I wish I knew. Yeah. The question is, what do you do with cats with diabetic cats with chronic pancreatitis? And they are a real challenge, and they do come together. They are an absolute real challenge. And you do everything you can, low fat diets for those cats for sure. I would not put a cat like that on a high-fat, high-protein diet. That's another exception to that rule. Lower fat diets. Some people these days are trying to use low-dose prednisone as an anti-inflammatory to control the pancreatitis. Do everything that you can to control the pancreatitis. And when they have flare-ups, their diabetes just may go more out of control, and there's not much you can do about that. The question is, does feeding small amounts frequently throughout the day help normalize blood sugar in those cats? And it really probably does in all cats, to be honest. In some ways, the ideal feeding schedule for a diabetic is small, multiple meals. I mean, that's what human diabetics do for themselves. So if you're eating small, multiple meals, the postprandial hyperglycemia is never going to be that much because they're not taking in that many calories at any one time. So in some ways, that's the ideal, and it certainly can help with pancreatitis cats. The flip side of that is it's very important to monitor for a cat or any diabetic that it is eating. And when they're eating small, multiple meals throughout the day, especially in a multi-cat household, whether or not they're eating becomes more difficult to assess. And if they're not eating and they still get their full dose of insulin, you have a higher risk of hypoglycemia. So that's the downside of doing small, multiple meals. But especially in a single cat household, where even though it's small, multiple meals, you know whether that cat is eating or not, that is actually a very good way to feed them. I'll take one more question this way, and then I'm happy to take any more up front. That's a good question. What are my thoughts on the AlphaTrack glucometer? And I like the AlphaTrack a lot, and that's the one that I recommend. Abbott is coming out with a new AlphaTrack. I don't know if you're aware of that yet. It's purple for what, that was a big selling point, it seemed. So it is a new AlphaTrack monitor, which definitely it's easier to use in some ways. And hopefully it's just as good as the old one. There's no reason to believe that it wouldn't be. And I'm a big fan of the AlphaTrack. I think the AccuCheck is okay for dogs as well. For cats, I think the AlphaTrack is definitely the better way to go. Okay, thank you very much, and I'll take any other questions up here.